بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته.
A 25-year-old athlete presents with 2 days history of fever, cough, runny nose, body aches, headache and diarrhea. His temperature is 101 degrees Fahrenheit, chest is clear and there are no sign of dehydration. He is just returned from China. You suspect influenza H1N1 infection. What is the single most appropriate step? A. Acyclovir. B. Amantadine. C. Interferon. D. Paracetamol. E. Oseltamivir. Answer is D. Paracetamol. Once again, me Dr. Salman. Today I will speak about swine flu, H1N1. Flu, also called influenza, is a viral infection of the nose, throat and lungs, which are part of the respiratory system. The viruses that cause influenza are divided into 4 categories named with letters. Influenza A is the most common type. The others are influenza B, C and D. H1N1 flu is a subtype of influenza A. Swine flu, H1N1, is an infection that a type of flu, influenza, virus causes. It's called swine flu because it's similar to a flu virus that affects pigs, swine. The virus leads to a lung, respiratory, disease in pigs. Swine flu, H1N1, is a respiratory infection in humans. Influenza viruses are further divided into subtypes. These subtypes are grouped based on 2 proteins on the surface of the viruses. One protein is called hemagglutinin, H, and the other is neuraminidase, N. There are many H&N subtypes and each one is numbered. H1N1 flu is a subtype of influenza A. Each influenza subtype includes many different strains of influenza virus. Not all strains infect people. Subtypes of influenza viruses currently found in people are strains of H1N1 and H3N2. Each year's flu vaccine includes varieties of these strains, and influenza B. Major outbreaks of H1N1 strains in humans include the 1918 Spanish flu pandemic, the 1977 Russian flu pandemic, and the 2009 swine flu pandemic. It is an automyxovirus that contains the glycoproteins hemagglutinin, H, and I. The influenza virion is roughly spherical. It is an enveloped virus. The outer layer is a lipid membrane which is taken from the host cell in which the virus multiplies. Inserted into the lipid membrane are glycoprotein, spikes, of hemagglutinin, Ha, and neuraminidase, Na. The combination of Ha and Na proteins determine the subtype of influenza virus, A, H1N1, for example. Ha and Na are important in the immune response against the virus, and antibodies against these spikes may protect against infection. The antiviral drugs Relenza and Tamiflu target Na by inhibiting neuraminidase and preventing the release of viruses from host cells. Also embedded in the lipid membrane is the M2 protein, which is the target of the antiviral adamantines amantadine and rimantadine. The influenza virus life cycle can be divided into the following stages: entry into the host cell, entry of VRNPs into the nucleus, transcription and replication of the viral genome, export of the VRNPs from the nucleus, and assembly and budding at the host cell plasma membrane. In this review, each stage of the viral life cycle will briefly be described. Antigenic drift is a result of the gradual accumulation of mutational changes in the genome. Some of these changes will be neutral and some will be favored, disfavored. Changes will not accumulate in the population. From the beginning to end of a winter, flu season, or from one winter to the next, a given strain of influenza virus may change by 1% or so at the nucleotide sequence level. 1% of 12 kilobits is 120 nucleotides. Thus, there is a gradual change at the amino acid sequence level in some parts of some of the viral proteins. Over a decade or so, a given strain of influenza virus can change quite significantly in, for example, the region of heart to which antibodies bind. So, your memory B cells and memory T cells from a case of flu you had just a few years ago may not be able to protect you from getting the flu from the same strain now. Antigenic shift is a sudden major change in antigenic type. This can result from a mixed infection in a single cell with 2 influenza type A strains, producing a new strain with some genome pieces from each original strain. Strains of influenza are defined mainly by their Ha and Na structures, since these two variant surface glycoproteins are the major targets of antibody binding. So, if we imagine an H1N1 strain and a H2N2 strain infecting the same cell in the same organism, human or non-human, we could expect that it might be possible that one of the new variants produced from this infected cell might have the H1 Ha coding RNA piece and the N2 Na coding RNA piece. If this new mixed genome variant is indeed infectious, it could be the beginning of a new strain of influenza virus type H1N2. This kind of recombination to produce a new strain is not necessarily limited to the Ha and Na genome segments. Thus, we could imagine that there may be various possible viable combinations that could result from an infection with two strains. H1N1 symptoms: fever, cough, sore throat, runny or stuffy nose, body aches, headache, chills, fatigue and diarrhea and vomiting, rare. Examination: GPE and vital signs. In positive H1N1 cases, fever of 100 to 104 F may be seen along with tachycardia. Also, a fatigued appearance. Pharyngitis might be present. Eyes red and watery. Lung exam: clear lungs, focal wheezing, rheunchy in positive cases. Confirmation of diagnosis: usually based on clinical suspicion, rapid diagnostic tests may be used, but not 100% exclusive if negative. Non-pharmacological. Inform concerned health authority agencies. Patient reassurance. Use of facial masks as it is a droplet spread infection, spread by coughing or sneezing, proper hand washing. Social distancing, avoiding contact with infected people and large gatherings if more people infected in community. Pharmacological. Oseltamivir, Tamiflu, might be started for patient and child if one of the following situations is met. Treatment of uncomplicated acute illness due to influenza infection in patients greater than 2 weeks of age who have been symptomatic for as less than or equal to 2 days, 5-day course. Prophylaxis of influenza in patients 21 years of age, 10 days, if widespread community infection. Dosage: adults 75 mg twice daily PO. Children, treat for 5 days. 22 weeks to less than 1 YR, 3 mg per kilogram twice daily. 1 to 12 years, less than 15 kg, 30 mg twice daily. 15.1-23 kg, 45 mg twice daily. 23.1-40 kg, 60 mg twice daily. 240.1 kg, 75 mg twice daily. Referral to internal medicine is needed. Please like, share, comment, and subscribe my channel. Press the bell icon. Allah Hafiz.